Imagine trying to speak, move, or even smile, but your body won't respond. Today, we are stepping into what patients experience during stroke. The brain needs a constant supply of blood to deliver oxygen and glucose, which its cells rely on to produce energy and stay alive. And without blood, the brain cells will begin to lie, and this may lead to serious damage like a stroke. So, we are explaining why the brain needs a constant blood supply. This is in order to deliver glucose and oxygen. And this provides energy and oxygen to the cells in order for them to stay alive. Without proper blood flow, even for a few minutes, the brain cells will begin to die, and this will lead to damage, like in the case of a stroke. So, a healthy circulation is always essential to the body in order for the brain to survive. What is a stroke? What is stroke? So, blood flow suddenly is blocked. So, a stroke is a neurological insult or injury whereby the blood supply to the brain is uh, abruptly or suddenly blocked. So, like here we can see these are cells. Here we have the brainstem. Here we have the basilar artery. For example, if we cut off the blood supply to the brain at this point, this will lead to a stroke. This will lead to loss of blood and oxygen to to the brain tissues and the brain cells. And as that happens, the brain cells start experiencing what we call ischemia, which is basically the death of the brain cells, and this is an emergency medical condition. So the brain cells begin dying when the blood flow stops because they lose oxygen and glucose. And oxygen and glucose are essential for producing energy. Without energy, the vital processes of the body will fail, and this will lead to rapid damage and death of the brain cells. So the brain cells rely on oxygen and energy, oxygen and glucose to provide energy. And this oxygen and glucose will come from the constant blood supply that the brain receives. So oxygen supply will suddenly stop. This will lead to loss of energy to the cells. Why is that? Because loss of oxygen and glucose. This leads to brain tissue damage, and this is always a permanent injury. In most cases, it can be resolved. However, in some patients, it may be a permanent injury. So different areas of the brain will control specific functions like movement, speech, vision, and memory. And when a stroke happens, it affects a particular region, and the abilities that are always linked to that area can be lost or impaired. So the brain controls specific body functions. There are different brain areas. For example, here we have a diagrammatic representation. Here we have the cerebellum. We have the occipital lobe, which is found at the back. We have the parietal lobe. We have the temporal lobe. We have the frontal lobe, which is found at the front. Then we have the sensory and motor cortex. So an impairment to these different areas different different impairments to the body. For example, we have the speech specific area, we have the vision area, which is controlled by the occipital lobe. So when different parts of the brain are affected, it will lead to different uh, presentation. So movement problems during a stroke happens because the brain can no longer properly send the signals to the muscles. And this can lead to things like weakness, loss of coordination, or paralysis, and it often happens on one side. So we can see here is a diagrammatic representation. There's weakness on one side and it appears suddenly. One side of the body is affected. Here we have the arm and we have the whole arm and the lower limb only affected. And this has led to difficulty walking. Then speech and thinking problems occur when a stroke affects areas of the brain that are responsible for language and cognition. And these patients may struggle to speak clearly, they may struggle to understand words or process thoughts and even make decisions. So this is what happens when uh, the speech and thinking when the area that are responsible for language and cognition are affected. There is problem with speech. They struggle to speak clearly. The slurring of the speech, their words are difficult to understand. They cannot think clearly. They are confused and they have a problem with uh, communication, their thought processes, and making decisions. So brain swelling happens after a stroke as injured brain cells and surrounding tissue react by accumulating fluid. So the injured areas will react by accumulating fluid and the swelling will increase the pressure inside the skull, which can further damage the brain cells and worsen the symptoms. So the brain tissue becomes swollen, pressure inside the skull increases. Remember, the skull is a rigid area where by with increase in pressure it cannot expand to accommodate the increase in pressure, and this will lead to damage that may spread further. This is usually an urgent medical condition that requires treatment since the swelling will increase the pressure within the skull and it can further damage the brain cells and lead to more worse symptoms. So why does early treatment matter? Early treatment matters because restoring blood flow quickly can save the brain cells before permanent damage can occur. Early treatment matters because restoring the blood flow quickly can save the brain cells before permanent damage occurs. That is why we usually have a window of around 4 hours from the onset of stroke, that is in case of the transient ischemic attack. So within the period of 4 hours, uh, the patient should already have gotten into the hospital for treatment, and with that, uh, the problem can be arrested before further damage is spread. And the faster a stroke is treated, the better the chances of recovery, and it reduces long-term disability. So, as I have said, the brain cells usually die rapidly, and minutes and even seconds will usually make huge differences. And early treatment will restore the blood supply and make the chances of recovery better and reduce the long-term effects of stroke. Usually damages the brain quickly, and recognizing these early warning signs is very important. And we use the acronym first to remember the early warning signs. So we have the face is there drooping on one side of the face. The arms, can they lift both arms upward, or is there a problem with the difficulty lifting the arm upward? Then the speech, do they have any speech difficulty with slurring, the communication, understanding? Then you should know that it is time to call for an emergency. So stroke is a medical emergency, and recognizing the signs and acting fast can save a life or protect the brain from lasting damage. So if you or someone around you shows symptoms, you should seek help immediately. Every second truly counts and matters when it comes to stroke.